I'm going to talk about from pandemic to epidemic. Now, normally I would be giving a disclosure, a financial disclosure, but it turns out my only disclosure today is that I have been affected by the pandemic too. And I hope that you haven't deteriorated to this extent. I'm going to talk about things that I think relate to this issue of how the pandemic is affecting us. I'm not going to talk about it specifically, not use too many numbers, but I do want to talk about some principles. And the principles are related to entropy, biomechanics, the tissues that are involved, the epidemiology of injury, which we've heard about already, and some evidence to support this. And then finally, with a discussion about how I think we should prevent these injuries. So one might ask, what about entropy? Well, my father used to teach a course in thermodynamics at the university, and he used to tell us around the dinner table about entropy, and I thought this was completely irrelevant to me as a teenager. But it turns out we're all involved in this universal process of degradation, running down, trending towards disorder, and these are things that relate to our aging and disuse. So to explain entropy a little bit more clearly, if we drop a cup on the floor, it smashes into multiple pieces. We can't take those pieces and drop them and form a cup. It requires a lot of energy to do so. And this is a universal law that we cannot change. And during the pandemic, we are tending towards disorder. If we look at the biomechanics and view these young kids playing in recreational ways, they are loading their tissues normally. This load, the biomechanical load through their joints and muscles, really is one that helps them grow and develop and get stronger and more resilient. Whereas as we go to a more elderly population, these biomechanical loads can lead to damage and problems and require us to go from a sport like running to biking, or in my case, even to e-biking. Next slide, please. An old friend of mine developed this theory, and he calls it the envelope of function theory, where the idea is that we live within a zone of homeostasis on the bottom left of this graph. And as we move towards the top right, we exceed our zone of homeostasis through increasing the load on our tissues. And eventually this leads to failure. And this failure can occur with an intense load on the left side or with respect to increasing volume or frequency. It's much easier to look at this from the standpoint of our happy zone on the lower left, what we can gain through training if we push ourselves through a reasonable threshold. But if we go too far, this will result in injury. So I want you to keep this graph in mind. I'd next like to address all of the tissues that are involved in our injuries, whether it's from bone to the meniscus in our knee. If we look at what happens when we enter the pandemic and we start reducing our activity, our bone becomes more porous. In other words, it has more holes in it. The bone becomes weaker, and it is susceptible to injuries, such as what happened last weekend to this professional footballer, where he developed a stress fracture in his foot. The same thing can happen to our tendons. If they get inflamed, they are weaker, or if they weaken over time, then they can rupture. So we can see injuries both from an acute standpoint and also from an overuse standpoint. Now, when it comes to muscle, we typically think that as we work out, we can get stronger, our muscles will get better. But if we've had a previous injury like this athlete, then recovering from the injury results in weakness in these muscles, and they become susceptible to injury despite doing something that he may have done thousands and thousands of times. With respect to ligaments, The picture on the top right is a normal ligament with the wave pattern that allows us to be resilient in our activities. But despite this, we can do something again many times and then rupture this ligament, which results in changes in the joint and damage to the joint over time. If we think about the discs in our backs and we do an MRI, we can see a normal disc or we can see a damaged disc as we see at the bottom here. The same thing occurs to the menisci in our knee. And even though the meniscus might still be present, if we do an MRI of this knee, it'll show that the meniscus is damaged and torn, where in fact this is really an effect of arthritis. So all of these things are impactful as we move from the pandemic forward. So if we go back to this graph, what is happening in the last 19 months is that everything is shifted to the left. Our happy zone is much smaller. The threshold for training is less. And most importantly, the threshold to injury is much less, with a lower load or intensity resulting in injury, or a lower frequency or volume of activity resulting in injury. If we move on to the epidemiology of injury, and we've heard a lot about that already, but two of the most important factors that would lead to injury are a prior injury, such as in our quarterback. He had a bad injury to his ankle and now he's injured his muscle, or a change in the activities that we do, change in volume, intensity, or technique, for example. And this is an example of what happened earlier this year. The Saskatchewan Roughriders returned to play, and on one day, 4 of their athletes tore Achilles tendons, and they hadn't even played a game yet. When the gyms closed and the pools closed, running outside seemed the only option, and yet within 3 days, a runner would start getting Achilles tendonitis and was injured to the point where they couldn't continue. And then what's left? So if it comes to prevention, which is the focus of this forum, we have to consider different strategies for acute and overuse injuries. And Carolyn has nicely described many ways that her research has resulted in a reduction of acute injuries. The same principles, to a greater or lesser extent, can apply to overuse injuries as well. If we're going to prevent injury, we have to understand how to do that. And there are certain risk factors that we can do nothing about, such as our age, our sex, and the genetics that we carry with us. So as much as I would like to change the strong family history of arthritis that I have in my genes, there's nothing I can do about that. However, the modifiable risk factors, such as the type of activities that we do, so going from running to e-biking, the delay returning to sports so we reduce our risk there, or adjusting the intensity and volume of training that I'm sure Matt is going to address later, are the ways that we can prevent injury, whether these are acute or overuse injuries. So this is what I do on a daily basis. I fix torn anterior cruciate ligaments. And if we follow our patients over time, which a lot of us don't always do, we find that the injury rate continues to go up. 2 years, 10% of our patients have re-injured one or the other knee, and by 5 years, 20% of our patients. Well, these are alarming statistics that our research has demonstrated that before really weren't paid much attention to. So what it boils down to is if our patients that we operate on are going to avoid injury, then we have to understand how rehabilitation will reduce that risk, and tell patients that it takes 13 months to get back to their sport, not 6, and that most people actually don't get back to the same level of activity. And with this knowledge, we can move forward and advise people so they don't have devastating second or third injuries to an already reconstructed knee. So what this boils down to in terms of prevention is restoring a balance. And I think we can all reflect on the last 19 months where the balance in our lives has not been met. And now that we pull through this pandemic, we have to make sure we apply these principles of entropy, biomechanics, understanding injuries, and maintain a balance going forward. So in summary, the pandemic has really been a perfect storm. If we understand these principles that I articulated, then hopefully we can adjust and improve and prevent overuse and acute injuries. But ultimately, it's about restoring a balance for each and every one of us on an individual basis. And thank you very much for your attention.